you're in charge of sort of planning the vaccine distribution for Trumbull County and the EMA, basically, correct?
Yeah, I'm the planning section chief for the emergency management, or correction, the emergency operations center. I'm part of the Trumbull County Fire Chiefs Association's incident management team. So we were called in early on in the pandemic to help the county with whatever problems that they needed. And so I ended up taking over the role as planning section chief.
All right. Talk to me about sort of your plans once we get a vaccine here, what you guys are going to be doing.
Well, the plan is actually, it's in a couple different components. So when you saw the governor's announcement today about how the vaccine was rolling out, the first part of it has to deal with the hospitals, and you notice that the pharmacies were involved with that. Well, that's because the pharmacies are going to be responsible for helping the long-term care facilities, developmental disability facilities, mental health homes, all those places for them to get their vaccine. And that was set out in the plan like well ago when they were originally looking at how to distribute it. So the announcement that you heard today, those are all what they referred to as Tier 1A distributions. So that was the healthcare workers that are in direct contact with COVID patients, the long-term care facility folks that included that developmental disability, mental health, those ones, and then EMS providers. Now, you saw that they did it in a two-tiered approach as far as distribution is concerned. So the Pfizer vaccine is going to come out first, and that's going to go to the hospitals and to the pharmacies to work with those long-term care facilities. That doesn't involve what we're doing. That's all going to be on the hospitals, the pharmacies, and the long-term care facilities to manage that. What we're managing is the distribution to the EMS providers. Originally, we were being told that it was going to be EMS, fire, law enforcement. And you saw what he came out with today. He just said EMS providers. So we're still trying to get some answers on that as to whether it's going to be all encompassing, to whether those that don't hold EMS certifications or don't run on ambulances regularly are going to be qualified in that group, and whether law enforcement is going to be qualified in that group. And that is looking that we won't even have the potential to receive the vaccine until maybe the 22nd. The December 15th date appears to be the date that it's going to be rolled out to the hospitals and to the nursing homes, or the pharmacies, I mean. And it doesn't look like it's until December 22nd that the Moderna vaccine is going to be rolled out to the health departments for us to be able to get that distributed to the EMS providers.
So there's still a lot of questions that you guys have, I'm guessing.
There are, and that's been part of the concern with this whole planning process, is that a lot of information that we have needed on the local level has been slow in coming from the state level. There's an entire website that we have to register on as distributors. Some of the information that we've attempted to obtain has been slow in coming from ODH directly, not from the local health department. I mean, I want to say that with the local health department, any questions that we've had, particularly from the first responder level, those have been answered immediately. At best, we maybe sat for a day looking for an answer. Unlike some of the questions that we've posited out to ODH, where we've been waiting for a few weeks. And some of those answers are directly tied to our ability to plan. Planning always has variables in it. But some of the big variables that we have are concerning for us to be able to get it out in a timely manner. With the announcement today, we've been waiting for this announcement now for quite some time. We had indications, I want to say probably about a week, maybe a week and a half ago, that December 15th would be a rollout date, but we didn't know exactly how it was going to get rolled out. We knew that the list that was provided today, we knew that list was going to likely be the list as to who was going to get the vaccine first, but we didn't know about this break in tiers until today. So there's some things that it makes it difficult, but not necessarily impossible to plan for, but it's obviously something we have to factor into everything. To get the vaccine on the 22nd, let's even assume that we get it on the 22nd, we're now talking about having to distribute the vaccine during the holidays. Christmas through New Year's. And there's two logistical problems that are there alone. You may have people that are not in the area for the holidays, or are not willing to travel out during the holidays because that is their time and they're wanting to be home, or, once again, they're going to see, direct family that they're normally in contact with. Obviously, they're not going out to violate advisories, but they're going to see family that they are direct contact with. And the second is obviously being able to have people that are able to distribute the vaccine during that time. So there's a couple logistical issues there too that we have to overcome.
Now, you talk about those logistical issues, but is there another logistical issue? Is this the vaccine that you need to get 2 rounds of? And I guess okay, and I guess you're basically, some of the people show symptoms of COVID after they get the first round. So you can't have those people working, obviously. So how do you plan for that? Because I know we need to get the first responders basically vaccinated that can get vaccinated. And you can't vaccinate everybody in the same day and have everyone the next day call off sick. So
right. So remember that EMS providers, and actually all these tier 1 folks that are working are considered essential employees. And there's 2 different algorithms that we look at for quarantining. There's one for non-essential employees. There's another for essential employees. And our operations section did a really great job of setting out those algorithms for folks as to what they do in the event that they're exposed and if they're symptomatic or asymptomatic. Now, certainly that's a challenge for us to be able to determine whether they're actually COVID positive or if they're having a reaction to the vaccine. We are still waiting to see the inserts from Pfizer and Moderna as to what types of side effects we should expect. We could be expecting the exact COVID type symptoms. We could just be seeing localized responses. We don't know about that yet. And both of these vaccines require 2 doses. There's only one vaccine that's being developed right now that we're aware of that requires 1, but the Pfizer and the Moderna both require 2. So we're looking at the fact that we've got to distribute this vaccine. We're going to distribute it. The plan is to distribute it over a consecutive 3-day period for the first dose. And then we have to wait that 21 days to distribute it again. At that point in time, in between, we're going to have to be monitoring those folks. And based on what we get from the pharmaceutical companies as to what we're supposed to look for side effects is going to dictate what we're going to end up doing with people at that point. All of our public safety entities are doing a really good job of making sure that even while they're in-house, at their fire stations, at their police stations, at their EMS stations, that they're masked. And when you talk about that essential employee algorithm, for example, if someone is exposed to someone, but they are not symptomatic, then they can be at work with a mask on, as long as they're considered to be in that essential employee category. That may be something that we're going to address there. We really don't know because we don't know what side effects we're looking at with the vaccine until we get the inserts that have those descriptions for us.
now, when it comes to distributing this vaccine, I know you said there poses a lot of challenges with the timing. Did you figure out a location yet where you guys will be distributing this vaccine to?
Yes, for all the public safety providers in the county, they'll actually be coming to the fire station in Vernon Township. One of the logistical issues that we have is that we were told in the beginning that when the vaccine is actually distributed, it can only go to the point of distribution. So it can't go to one location, then be moved to another. The only place where it can go and sit is from the actual warehouse to where the point of distribution is. Based on the ability for us to be able to distribute it, along with arrangements to get the buildings and the money that's associated with it to ensure that we have a proper location, everything's going to be done at my fire station. So there'll be 3 consecutive days. My station has a very large open hall for it that we're actually tomorrow going to be getting laid out so that we have the appropriate areas and the appropriate social distancing so that we don't have to worry that. We have a great space. It just so happens we're in the northeastern part of the county, so it's not necessarily central, but it is adequate for the need that we have with this, considering we have to monitor these vaccines. It gives me much more control, and we should be able to do it a bit more efficiently.
Now, as a side note, is that something when you guys get the vaccine that I could come get video of when you're distributing it to first responders?
When we get it, I don't care if you come up when we get it, if you want to see when we get it. I don't care if you want to come up and see when we distribute it. I mean, obviously, we'll try to be, as privacy oriented as possible.
Yeah.
So it's probably going to be general clips. I can't necessarily say it's going to be, hard down clips, but it's at least something you can see.
Right. I mean, I won't identify people if they don't want to be identified, basically. But yeah, could you just shoot me a text or whatever when you know when the plans are more ironed out, I guess.
Yeah, I mean, we've been on this really since the last time you were up to see us at the EOC, and a lot of it just flat out stalled because we had no information as to when to expect the vaccine, and we had no information or vague information as to who was supposed to get it when. Obviously, our goal is we want to get it out before the end of the year. And our hope is that we were going to get it in the December 15th push out. The only advantage that I see with the fact that we're supposed to be getting the Moderna is information that I've read is that it doesn't need to be kept as cold as the Pfizer vaccine.
Okay.
That was one of our logistical concerns, was that the Pfizer vaccine has to be kept at negative 80 degrees. Celsius, which is around 100 and 111, 112, 114 degrees Fahrenheit. And we heard that well on in the beginning, well before you were even up to see us. And so we already had our plans in place to have the dry ice. And we actually were able to get it locally. But now that may not be as much of a concern. We may be able to refrigerate it with less complications than with the dry ice. Like I said, these are those little complications that come in there that you're planning for one thing and then something else comes up, or you may not even expect it and it comes up. You know what I mean?
Right. So it's a lot of moving parts, basically. It's a fluid situation.
That's probably even an understatement as to how fluid it is. We see one thing, we're like, okay, we're going to go down that road, and we plan down that road, and okay, that road's the right road to go on, but next thing you know, there's a fork that nobody expected to be there. And we're really good as planners. I mean, the whole EOC that I've been working with, all those guys are great, and EMS and fire and law as a whole, we're all good at planning, and we're all good at dealing with fluid situations. This is a big fluid situation, and it does present some challenges to us when, every time you think you've got something set, something else is moving in there. And so that's probably our biggest one right now is that date of delivery for the vaccine. Like I said, he's saying December 22nd. We don't know if that's going to be December 22nd that vaccine is in hand, or if it's December 22nd that they're shipping it out.
Right, because then you could possibly not get it till like the 23rd or 24th, and then have to, start distributing it on Christmas or whatever. So, yeah.
Right. And, I don't know if we're going to get any, my assumption is we're going to get notification before it pushes. Because anytime in the past that we've, just like with Chief Lewis with the logistics section, when we've gotten those RSS pushes, they give us about a week's notice that it's coming. And then generally the Friday before, they say, okay, this is when yours is coming on that day. And so a lot of times we only have a few days notice that we're getting it. So once again, let's think about the logistical problem here. We have to hire people in to distribute the vaccine. And then we have to tell them that not only are we hiring them in to distribute the vaccine, but you may get a 12, 24, 36-hour notice that this is the day we're doing it, or these are the days that we're doing it. So you have to have people that are willing and flexible and fluid enough to do that as well. So there's just a lot of logistical pieces that we're dealing with, especially if we want to try to get it distributed before the end of the month. If we had more time to get it distributed or whatnot, then that would probably make it a little bit easier. But I don't want to have to try to wait to be able to get it out once I get it in my hands. Not only because I want to keep it to where the vaccine is still viable, but we deserve to get that out to these folks that have been dealing with this now since March, and now, you know, once again, over 200 cases again today. And I want to say it was in the 230s is what I'm hearing again today. I know the media release will be out, so you can get that number, but
I think it came out a little while ago. I did see it come across my email, but I was working on something else.
yeah, I want to say it's in the 230s again.
Mhm.
Yesterday was in the 230s. Today was in the 230s. You know, we have a little lull there, but now we're starting to see the increase in folks that are testing positive. I'm venturing probably from Thanksgiving. You know, we're a week out from Thanksgiving right now.
Mhm.
So you look at your 3 to 7 days, with the most of them in 5 days is when they're popping up. You know, people were out. We know people were out. We saw people out.
Right.
You know, order or not, or advisory or not, people are going to be out if they want to be out.